Stop everything you are doing for a moment, and I mean everything. If you are over 60, or you have parents who are, there is a lie that has been circulating for decades. A dangerous myth that keeps millions of people sleeping soundly at night while their organs are slowly shutting down. Here is the belief: if I'm not in pain, then I must be healthy. I am here to tell you, with absolute certainty, that when it comes to your kidneys, that is the most dangerous lie you will ever believe. You see, we are taught that if something is wrong, our body will scream for help. We expect chest pain to signal a heart attack. We expect sharp stabbing sensations to signal a broken bone. But your kidneys? They are the silent soldiers. They do not have pain receptors inside them to tell you they are bleeding out. According to the Centers for Disease Control and Prevention, nearly 4 out of 10 people with severe kidney damage don't even know they have it. They walk around, feeling fine, until the system collapses entirely. Today, we are going to break that silence. We are going to decode the secret whispers your body is sending you right now that you might be ignoring. I'm going to give you the 5 silent signs that your kidneys are struggling after age 60, backed by top nephrologists and research from the National Kidney Foundation. This isn't just a video. It could be the wake-up call that saves your life. Stay with me. Before we dive into the signs, you need to understand why this happens. Why does this silent killer target us specifically after we hit 60? It comes down to something called renal reserve. Think of your kidneys like a brand new car engine with 8 cylinders. When you are young, you can lose a cylinder or 2, and the car still runs smoothly. You don't feel the difference. You can drive at 100 miles per hour, and the engine purrs. But after 60, natural aging has already taken a toll. Studies from Johns Hopkins University show that kidney function naturally declines by about 1% per year after the age of 40. By the time you reach 60 or 70, your engine is running on fewer cylinders. So, when damage strikes, whether from blood pressure, sugar, or toxins, your kidneys work overtime to compensate. They mask the damage. They filter your blood until they physically cannot do it anymore. Dr. Leslie Spry, a spokesperson for the National Kidney Foundation, puts it plainly: kidney disease is a silent disease because often in the early stages, there are no symptoms. You might feel a little tired. Sure, you might blame it on getting older, but that is the trap. The kidneys are silently failing while you blame your age. So, how do you spot the trap before it snaps shut? Let's start with sign number 1. This is the most overlooked symptom. If you ask most people over 60 how they feel, they'll say, "I'm just tired." They accept fatigue as a standard part of aging. But what if I told you that chronic fatigue is often a sign of blood poisoning? Here is the science. Your kidneys are responsible for producing a hormone called erythropoietin, EPO. This hormone tells your body to make red blood cells. Red blood cells carry oxygen. When your kidneys struggle, they produce less EPO. Fewer red blood cells are made. You develop anemia. Suddenly, your brain and muscles are starving for oxygen. You feel like you're walking through mud all day. You wake up after 8 hours of sleep and feel like you haven't slept at all. Research published in the Clinical Journal of the American Society of Nephrology found that fatigue is the single most common symptom reported by patients with chronic kidney disease, often occurring before they are even diagnosed. So, ask yourself, are you just getting older? Or is your body suffocating on a lack of oxygen because your filters are clogged? Don't just brush it off. This is your first red flag. Sign number 2 is obvious, yet people are embarrassed to talk about it: changes in urination. Your urine is a window into your internal health. It is the only way you can literally see what your kidneys are doing. But you need to know what to look for. First, foamy urine. If you flush the toilet and see bubbles that take a long time to disappear, like the foam on a latte, that is not air. That is protein. Specifically, a protein called albumin. Healthy kidneys grab onto protein and keep it in your body because you need it. Damaged filters let it slip into your urine. The Mayo Clinic states that persistent foamy urine is a primary indicator of proteinuria, a major red flag for kidney disease. Second, the frequency at night. Do you find yourself waking up 2, 3, or 4 times a night to pee? This is called nocturia. While some men immediately think prostate, it could also be the kidneys. When your kidneys can't filter efficiently during the day, the fluid builds up in your tissues. When you lie down at night, that fluid returns to the bloodstream, and the kidneys rush to flush it out. If your bathroom habits have changed dramatically in the last few months, your body is waving a red flag. Don't look away. Moving to sign number 3. Look at your ankles right now. Take off your socks. Do you see an indentation where the elastic band was? Do your ankles look puffy, like they've been filled with air? This is called edema. We talked earlier about how kidneys filter out waste. but their other main job is removing excess fluid. When the kidneys slow down, they stop removing that extra water. Gravity pulls that fluid down to your legs and feet. But it doesn't stop there. You might also notice puffiness around your eyes, especially in the morning. Why the eyes? The tissue around your eyes is very soft and sensitive. It retains fluid easily. Many people ignore this, thinking, it's just the heat, or I ate too much salt. And while salt is a culprit, persistent swelling is a sign that your internal drainage system is failing. You are essentially drowning from the inside out. If you are retaining water, your heart is working harder to pump it, and your kidneys are failing to move it. It is a vicious cycle that needs attention immediately. Sign number 4 is one that sends shivers down my spine because of how misunderstood it is. Do you have unrelenting itchy skin? Does it feel dry no matter how much lotion you use? Dermatologists call this uremic pruritus. People spend fortunes on creams and pills, trying to fix the skin from the outside. But the problem isn't on your skin. The problem is in your blood. Remember, the kidneys are filters. When they fail, waste products like urea and nitrogen build up in your bloodstream. Think of your blood like a fish tank. If the filter is broken, the water gets dirty. The fish gets sick. Your skin is the largest organ in your body, and when toxic waste flows through your veins, your skin reacts by itching. It's a constant, deep itch that you can't scratch away. A study from the University of California, San Francisco, highlighted that up to 40% of patients with end-stage kidney disease suffer from severe itching. If you are slathering on moisturizer and nothing is working, stop looking at the bottle and start looking at your kidneys. Your blood is telling you it is dirty. And finally, sign number 5. This is the one that scares people the most. We all have senior moments, right? We walk into a room and forget why. We can't find the right word. We blame it on aging or stress. But severe, sudden brain fog or difficulty concentrating can be a direct result of kidney dysfunction. This is a condition called cognitive impairment of renal origin. Your kidneys regulate the balance of electrolytes in your body, things like sodium, potassium, and calcium. These electrolytes act like batteries for your brain. If the kidneys are struggling, these levels get thrown off. Toxins that should have been removed are still circulating, crossing the blood-brain barrier, and literally poisoning your brain cells. Researchers at Temple University found a significant link between reduced kidney function and reduced cognitive function in adults over 60. The brain simply cannot function clearly if the blood flowing to it is toxic. If you feel like your head is constantly in a fog, if you feel confused or unable to focus for days at a time, it might not just be getting older. It might be that your brain is crying out for cleaner blood. Now that you know the signs, you have to ask yourself, am I in the danger zone? While anyone can develop kidney issues, the risk skyrockets if you have these 3 conditions. Number 1, high blood pressure. This is the silent killer's partner. High blood pressure damages the tiny blood vessels in the kidneys. If you have hypertension and aren't managing it tightly, you are slowly destroying your filters. Number 2, diabetes or prediabetes. High blood sugar is like syrup to your kidneys. It clogs them up, makes them work harder, and burns them out. The CDC states that diabetes is the number 1 cause of kidney failure. Number 3, family history. If your parents or siblings had kidney disease, your risk increases genetically. If you are over 60 and fall into any of these categories, you cannot afford to be passive. You are not a spectator in your health anymore. So, what now? You watched this video, you recognize the signs, and you might be terrified. But fear is useless without action. Here is your roadmap to fighting back. Step 1, the water revolution. It sounds too simple, but it is the truth. Most seniors are chronically dehydrated. Your kidneys need fluid to flush out toxins. Aim for at least 6 to 8 glasses of water a day, unless your doctor has restricted it for other reasons. Water is the cheapest medicine you will ever take. Step 2, ditch the salt shaker. Salt holds onto water. More water means higher blood pressure and more work for your kidneys. Try to cut your sodium intake. Your palate will adjust, and your kidneys will thank you. Step 3, beware of safe painkillers. This is huge. Many of us pop a pill for back pain or headaches. Common drugs like NSAIDs, ibuprofen, naproxen, can decrease blood flow to the kidneys and cause acute damage, especially in older adults. The Harvard Health blog warns that chronic use of these painkillers is a leading cause of kidney disease. Switch to Tylenol, acetaminophen, only if necessary, and always consult your doctor first. Step 4, get the simple test. You don't need a biopsy. You don't need a scan. All you need are 2 blood tests. GFR, glomerular filtration rate, to see how fast you filter. Creatinine levels to check for waste buildup. Ask for these at your next checkup. They are cheap, easy, and they can save your life. Now, I need to be very clear with you. This video is for educational purposes only. It does not replace professional medical advice, diagnosis, or treatment. If you have these symptoms, please, go see a healthcare professional immediately. we've covered a lot of ground today. We talked about fatigue, swelling, itching, and brain fog. We shattered the myth that no pain means no health. Here is the bottom line: your kidneys work 24 hours a day, 7 days a week, filtering 200 quarts of blood every single day. They don't ask for a vacation. They don't ask for praise. They just keep you alive. But they are fragile, especially after 60. You have the power to protect them. You have the knowledge now to spot the signs before it is too late. Don't let this video be just another 10 minutes of entertainment. Let it be the turning point. If you recognized even one of these signs in yourself or a loved one, do not wait. Make the appointment today. Drink that glass of water right now. If you found this information valuable, if it opened your eyes to something you didn't know, smash that like button right now. It helps the algorithm show this video to someone else who might need to save their life. Subscribe to this channel and hit the notification bell because we are dedicated to bringing you the truths about your health that no one else is telling you. Tell me in the comments below, which sign surprised you the most? Was it the itching? The foamy urine? Let's start a conversation. Thank you for watching, and stay healthy.